And these are the subcut lines. That's for midazolam. The bottom one is for hydromorph.
Those are subcutaneous lines. We poke a very tiny little needle, about 1/2 to 3/4 of an inch long, into the subcutaneous tissue of a person's thigh, abdomen, or upper arm. Then the needle is pulled out, leaving a tiny little catheter and a line that medications can be administered through. Usually we hook up an infusion to a subcutaneous line. However, medication can be given intermittently like they were for that lady. Common medications that can be put into a subcutaneous line are morphine, Dilaudid, midazolam, Haldol, and dexamethasone. We can also put lorazepam in it, but it's thicker and a little harder to push in. I even had a patient on a subcutaneous methadone infusion one time. The medications are very concentrated because the subcutaneous space can't hold much in the way of volume. For that reason, we're unable to use fentanyl because the concentration is too low. Subcutaneous lines are great because they're not painful at all. In fact, I had nurses practice putting the needle into my arm and it hurt less than a bee sting, which I can confidently say because I got a bee sting on my finger the other day and it hurt like a bit. Also, there's a very low risk of infection and the line can stay in place for a long time, usually about 7 to 10 days, without any problem at all. Subcutaneous lines can also be used for hydration, which we don't do very often in hospice, but if it's needed for symptom management, it can be done that way. That's called hydrodermoclysis. Not a word you need to know, but it's really fun to say. Many hospices are now opting to use rectal catheters instead of subcutaneous lines because they are just as efficient and more cost effective. But if I'm the hospice patient, I'm going to want the subcutaneous line rather than having something up my butt. That's just my preference. I'm a big fan of subcutaneous lines. I use them a lot when I was a hospice care center nurse, and I use them for home patients as well. If your person is having trouble swallowing their medications, ask your hospice nurse if a subcutaneous line could be an option for them.